Free CNA Practice Test 2026 Pass First Try Full Questions. Question 1. Behaviors that may signal pain in the elderly include all of these except which one? Option A. Insomnia. Option B. Not participating in social activities. Option C. Not eating or drinking. Option D. Excessive talking. The correct answer is option D. Excessive talking. Pain in the elderly often presents as withdrawal or changes in routine rather than talkativeness. Question 2. What is an important, but frequently forgotten, consideration when providing hair care? Option A. The age of the resident. Option B. The length of the resident's stay. Option C. The race and culture of the resident. Option D. The environmental conditions of the room. The correct answer is option C. The race and culture of the resident. Hair textures and cultural styles require specific knowledge and appropriate products. Question 3. A resident is late to therapy because she is slow at feeding herself. What is the best action? Option A. Bring the resident to breakfast earlier. Option B. Withhold breakfast until after therapy. Option C. Begin feeding the resident yourself. Option D. Take her plate away when it is time for therapy. The correct answer is option A. Bring the resident to breakfast earlier. Adjusting the schedule allows the resident to remain independent while meeting their appointments. Question 4. Which of these may depend on facility rules when performing nail care? Option A. Reporting blue or pale nail beds to the nurse. Option B. The policy on cutting toenails. Option C. The position of the resident during care. Option D. Soaking the feet before starting. The correct answer is option B. The policy on cutting toenails. Many facilities restrict nursing assistants from cutting toenails, especially for diabetic residents. Question 5. When is the most appropriate time to use a soft toothette? Option A. When a resident is having a seizure. Option B. When giving an unconscious resident mouth care. Option C. When a resident is complaining of a toothache. Option D. When a resident has full dentures. The correct answer is option B. When giving an unconscious resident mouth care. Toothettes are used for gentle cleaning when a resident cannot use a standard toothbrush. Question 6. What is a Hoyer lift primarily used for? Option A. Moving a resident onto a stretcher. Option B. Helping to move a resident to a chair. Option C. Helping to move a resident into a vehicle. Option D. Helping to move a resident into a bathtub. The correct answer is option B. Helping to move a resident to a chair. A Hoyer lift is a mechanical device used to transfer non-weight-bearing residents safely. Question 7. Which of these is an incorrect procedure for shaving a resident? Option A. Using a towel to protect clothing. Option B. Checking for bleeding problems first. Option C. Shaving upward from the chin to the sideburns. Option D. Shaving upward on the neck. The correct answer is option C. Shaving upward from the chin to the sideburns. To prevent irritation, shaving should follow the direction of hair growth, which is typically downward on the face. Question 8. A resident with left side weakness needs help with a sweater. Assistance should be given where? Option A. On the resident's right side. Option B. In front of the resident. Option C. On the resident's left side. Option D. Behind the resident. The correct answer is option C. On the resident's left side. When dressing a resident with weakness, you should always dress the weak side first. Question 9. Which of these is not a common mealtime challenge for residents? Option A. Chewing or swallowing problems. Option B. Decreased recognition of hunger. Option C. Not being reminded when it is time to eat. Option D. Loss of ability to use eating utensils. The correct answer is option C. Not being reminded when it is time to eat. Nursing homes have scheduled mealtimes, so lack of reminders is rarely the primary issue. Question 10. Bad breath and skin breakdown in the mouth are symptoms of which of the following? Option A. General dehydration. Option B. Dry mucous membranes in the mouth. Option C. An overly moist mouth. Option D, inadequate amounts of toothpaste. The correct answer is option B, dry mucous membranes in the mouth. Dryness in the mouth allows bacteria to grow and tissues to become fragile. Question 11. A nursing assistant is feeding a quadriplegic resident. Which action is inappropriate? Option A, offering small bites and allowing time to chew. Option B, encouraging personable conversation. Option C, sitting at eye level with the resident. Option D, offering drinks only after all food is consumed. The correct answer is option D, offering drinks only after all food is consumed. Fluids should be offered throughout the meal to assist with swallowing and hydration. Question 12. Why is morning care before breakfast important? Option A, it adds to a resident's sense of well-being. Option B, it helps to promote eating. Option C, it provides a pleasant appearance. Option D, all of these are correct. The correct answer is option D. All of these are correct. Hygiene before meals improves comfort and is a standard part of resident care. Question 13. Key considerations for bathing residents include safety, privacy, and which of these? Option A, quiet surroundings. Option B, dim lighting. Option C, a swiftness in the procedure. Option D, providing security. The correct answer is option D, providing security. Ensuring the resident feels physically and emotionally secure is vital during bathing. Question 14. Which of these is not a way to assist a resident to rest more comfortably? Option A, create a quiet environment. Option B, offer diversion activities like reading. Option C, remove all positioning devices so they do not interfere. Option D, pacing activities to allow for rest. The correct answer is option C, remove all positioning devices so they do not interfere. Positioning devices are often necessary to keep a resident comfortable and in alignment during sleep. Question 15. Which of these statements is false for the care of a resident's dentures? Option A, dentures are very slippery when wet. Option B, dentures should be stored in cool water. Option C, the denture care is left to the resident. Option D, dentures break easily and are expensive. The correct answer is option C. Denture care is left to the resident. Staff must assist with denture care if the resident is unable to do it themselves. Question 16. A small, watery leakage of stool could indicate which of these conditions? Option A, a gastrointestinal infection. Option B, a medication reaction. Option C, a fecal impaction. Option D, pelvic muscle weakness. The correct answer is option C, a fecal impaction. Liquid stool can seep around a hard, impacted mass, appearing as diarrhea. Question 17. Which of the following is an inappropriate action when providing hygienic care? Option A, a thoroughly drying skin to prevent breakdown. Option B, examine the skin for any injuries. Option C, apply extra lotion between the fingers and toes. Option D, encourage the resident to participate. The correct answer is option C. Apply extra lotion between the fingers and toes. Moisture trapped between fingers and toes can cause skin breakdown and infection. Question 18. It is time to bathe an Alzheimer's resident who has visitors. What is the best action? Option A, ask the charge nurse to speak with the visitors. Option B, ask the visitors to step out until the bath is complete. Option C, perform the bath the next day instead. Option D, ask the patient when you should come back. The correct answer is option B. Ask the visitors to step out until the bath is complete. Bathing is a private activity and visitors should be asked to leave to maintain dignity. Question 19. An electric shaver begins to spark and smoke. What should you do first? Option A, call the nurse in charge. Option B, finish the shave quickly. Option C, use the roommate's shaver instead. Option D, unplug the shaver. The correct answer is option D, unplug the shaver. The immediate priority is to remove the power source to prevent fire or injury. Question 20. A client is paralyzed on the right side. Where should the signaling device be placed? Option A, On the left side of the bed near the hand. Option B. On the right side of the bed near the hand. Option C. Under the pillow. Option D. At the foot of the bed. The correct answer is option A. On the left side of the bed near the hand. The call light must be placed where the resident can reach it with their functional limb. Question 21. To lift an object using good body mechanics, the nursing assistant should do what? Option A. Keep both feet close together. Option B. Lift with the abdominal muscles. Option C. Bend the knees and keep the back straight. Option D. Hold the object away from the body. The correct answer is option C. Bend the knees and keep the back straight. Bending at the knees shifts the work to the legs and protects the back. Question 22. The care plan says to use a mechanical lift, but the client is very agitated. What should you do? Option A. Lift the client without the device. Option B. Force the client into the lift. Option C. Get assistance to move the client. Option D. Keep wheels unlocked during the lift. The correct answer is option C. Get assistance to move the client. Safety for both staff and the resident requires extra help when a resident is non-compliant. Question 23. A client starts to choke and turn blue during dinner. What should the assistant do? Option A. Remove the food tray and find a nurse. Option B. Slap the client on the back. Option C. Call for help and perform the Heimlich maneuver. Option D. Give the client a drink of water. The correct answer is option C. Call for help and perform the Heimlich maneuver. Abdominal thrusts are the emergency response for a complete airway obstruction. Question 24. When giving evening care to a client with dentures, where should they be placed? Option A. In the bathroom on the sink. Option B. In a tissue on the bedside stand. Option C. Under the client's pillow. Option D. In a denture cup with the client's name. The correct answer is option D. In a denture cup with the client's name. Proper storage in a labeled cup prevents loss, breakage, or contamination. Question 25. What type of fire can be safely put out with water? Option A. Electrical fire. Option B. Grease fire. Option C. Paper fire. Option D. Chemical fire. The correct answer is option C. Paper fire. Water is only suitable for Class A fires involving common combustibles like paper or wood. Question 26. The nursing assistant is responsible for all of these fire prevention measures except which one? Option A. Taking cigarettes away from all clients and visitors. Option B. Being aware of the locations of extinguishers. Option C. Reporting damaged wiring or sockets. Option D. Participating in fire drills. The correct answer is option A. Taking cigarettes away from all clients and visitors. Staff enforce rules but generally do not confiscate personal property from visitors without specific cause. Question 27. What should you put on a client's feet before walking them to a chair? Option A. Socks or stockings only. Option B. Cloth-soled slippers. Option C. Rubber-soled slippers or shoes. Option D. Nothing. The correct answer is option C. Rubber-soled slippers or shoes. Non-skid footwear is essential to prevent falls during ambulation. Question 28. What is the most important reason for using soap and water to clean skin after elimination? Option A. To keep the client happy. Option B. To prevent soiling of bed linen. Option C. To remove feces and urine from the skin. Option D. To keep the linen costs down. The correct answer is option C. To remove feces and urine from the skin. Waste products are caustic and will cause rapid skin breakdown if not removed. Question 29. A nursing assistant should refuse to perform a task in which situation? Option A. The assistant has not been trained to do it. Option B. The client is difficult to deal with. Option C. The assistant can find someone else to do it. Option D. The assistant is at the end of their shift. The correct answer is option A. The assistant has not been trained to do it. Performing tasks without proper training is dangerous and against professional standards. Question 30. Before helping a client into a bath or shower, what should the assistant do first? Option A. Check the temperature of the water. Option B. Shampoo the client's hair. Option C. Soak the client's feet. Option D. Apply lotion or oil to the skin. The correct answer is option A. Check the temperature of the water. Testing water temperature prevents accidental burns. Question 31. When taking a client's radial pulse, where should the fingertips be placed? Option A. On the chest. Option B. On the wrist. Option C. On the neck. Option D. On the elbow. The correct answer is option B. On the wrist. The radial pulse is located on the thumb side of the inner wrist. Question 32. To whom does the certified nursing assistant report directly? Option A. The nurse supervisor. Option B. The physician. Option C. The staff development nurse. Option D. The administrator. The correct answer is option A. The nurse supervisor. The charge nurse or supervisor is the immediate superior in the nursing chain of command. Question 33. When communicating with a client's family, the nursing assistant should do what? Option A. Listen to concerns and offer support. Option B. Offer advice about medical treatment. Option C. Get involved in family problems. Option D. Share the latest facility gossip. The correct answer is option A. Listen to concerns and offer support. Providing professional support and listening are key parts of family communication. Question 34. While making an empty bed, you see that the side rail is broken. What should you do? Option A. Wait for the next safety check to report it. Option B. Report the broken side rail immediately. Option C. Tie the rail in the raised position. Option D. Warn the client to be careful. The correct answer is option B. Report the broken side rail immediately. Broken equipment is a safety hazard that must be reported at once. Question 35. A client is incontinent of urine right before dinner. What should you do? Option A. Take the client to dinner and clean up later. Option B. Clean the client and take them to dinner as soon as possible. Option C. Tell them not to eat until they have changed themselves. Option D. Insist the client eat dinner in their room. The correct answer is option B. Clean the client and take them to dinner as soon as possible. Maintaining hygiene and dignity is a priority. Clean the resident before they go to a public area. Question 36. A radio cord is draped across a chair to reach an outlet. What is the first thing to do? Option A. Tell the client it is a hazard and take it away. Option B. Unplug the radio and ask them not to use it. Option C. See if changes can be made so the radio can be plugged in safely. Option D. Take the radio to the activities room. The correct answer is option C. See if changes can be made so the radio can be plugged in safely. Problem solving to maintain safety while respecting resident property is the best approach. Question 37. A fire alarm sounds while you are walking with a client in a wheelchair. What should you do? Option A. Push the chair out of the hall and carry the client. Option B. Leave the client to search for help. Option C. Comfort the client while moving to a safe place. Option D. Lock the wheelchair and check for smoke. The correct answer is option C. Comfort the client while moving to a safe place. Reassuring the resident while moving them away from danger is the correct response. Question 38. You see a client spill water on the floor in the hall. What should you do? Option A. Call the nurse. Option B. Clean up the spill. Option C. Call housekeeping. Option D. Leave the spill. The correct answer is option B. Clean up the spill. Immediate action to clean a spill prevents accidents and is everyone's responsibility. Question 39. For safety, when leaving a client alone in a room, what must the assistant do? Option A. Keep the door tightly closed. Option B. Place the signaling device within reach. Option C. Apply a restraint to the client. Option D. Leave the bed elevated in the highest position. The correct answer is option B. Place the signaling device within reach. The call light is the resident's only way to ask for help when alone. Question 40. Physical restraints are used most often for what purpose? Option A. To prevent client injury. Option B. When staff is short. Option C. At the family's request. Option D. At the roommate's request. The correct answer is option A. To prevent client injury. Restraints are intended as a last resort to protect the resident from harming themselves. Question 41. If you are concerned about client care, whom should you speak to first? Option A. Another nursing assistant. Option B. The nurse in charge. Option C. The director of nursing. Option D. The administrator. The correct answer is option B. The nurse in charge. Following the chain of command means reporting concerns to your immediate supervisor first. Question 42. When taking an oral temperature, it is important to do what? Option A. Place the thermometer in the rectum. Option B. Place the thermometer under the arm. Option C. Place the thermometer under the tongue. Option D. Put lubricant on the thermometer. The correct answer is option C. Place the thermometer under the tongue. Correct placement in the heat pocket under the tongue is necessary for an accurate reading. Question 43. Pressure sores can often be prevented if the client is treated how? Option A. Placed in an incontinence brief. Option B. Positioned with a pillow under the head. Option C. Addressed in loosely fitting clothing. Option D. Turned or repositioned every 2 hours. The correct answer is option D. Turned or repositioned every 2 hours. Regularly relieving pressure on bony prominences is the most effective prevention. Question 44. If a client has hand tremors, the nursing assistant should do what? Option A. Restrain the hand with the tremor. Option B. Assist the client with daily living as needed. Option C. Tell the client to stop shaking. Option D. Do everything for the client. The correct answer is option B. Assist the client with daily living as needed. Supporting independence while providing needed help is the correct approach. Question 45. When assisting a client in resolving grievances, to whom should you report? Option A. The doctor. Option B. The family. Option C. The administrator. Option D. The nurse in charge. The correct answer is option D. The nurse in charge. The charge nurse is responsible for managing immediate resident complaints. Question 46. Avoiding unnecessary exposure of the client during care protects which right? Option A. Privacy. Option B. Confidentiality. Option C. Personal choice. Option D. Personal hygiene. The correct answer is option A. Privacy. Residents have the right to have their bodies protected from public view during care. Question 47. How should the female perineum be cleansed? Option A. From front to back. Option B. Without soap. Option C. With a disinfectant. Option D. From back to front. The correct answer is option A. From front to back. Washing from front to back prevents the spread of bacteria from the anal area. Question 48. When caring for a client from another country, the nursing assistant should do what? Option A. Be sensitive to the client's cultural needs. Option B. Force them to follow facility cultural practices. Option C. Promote group activity participation only. Option D. Decline to care for the client. The correct answer is option A. Be sensitive to the client's cultural needs. Culturally sensitive care is a requirement for treating the resident with dignity. Question 49. How often should a nursing assistant give an unconscious client oral hygiene? Option A. At least every 2 hours. Option B. At least every 4 hours. Option C. At least every 6 hours. Option D. At least every 8 hours. The correct answer is option A. At least every 2 hours. Frequent care is necessary to prevent infection and dry membranes in an unconscious patient. Question 50. Which action makes the procedure of moving a resident to a wheelchair safe? Option A. Place the bed in the low position. Option B. Place a pillow on the wheelchair seat. Option C. Lower both footrest pedals. Option D. Release the wheel brakes. The correct answer is option A. Place the bed in the low position. Keeping the bed low allows the resident's feet to reach the floor for stability. Question 51. A visitor enters the room while you are changing a client. How should you respond? Option A. Can you not knock? Option B. Hi, come on in. Option C. Boy, he was dirty today. Option D. Would you please wait in the lobby? The correct answer is option D. Would you please wait in the lobby? Maintaining resident privacy is more important than immediate visitor access. Question 52. A client looks forward to bingo each morning. What should the assistant do? Option A. Tell them you do not have time to get them ready. Option B. Plan the schedule so they are ready in time for bingo. Option C. Tell them you forgot but will go tomorrow. Option D. Ask the client to dress themselves. The correct answer is option B. Plan the schedule so they are ready in time for bingo. Supporting a resident's interests and schedule is part of quality care. Question 53. A confused client is begging to go home. What is your best response? Option A. Tell them, this is your home. Option B. Take them to the activity room. Option C. Ask the client to tell you about their home. Option D. Tell them you will take them later. The correct answer is option C. Ask the client to tell you about their home. Validation therapy and active listening help calm a confused resident. Question 54. If an alert client touches you inappropriately, what is your best response? Option A. Slap the client's hand. Option B. Step back and ask them not to do it again. Option C. Refuse to care for the client. Option D. Warn them they will be punished. The correct answer is option B. Step back and ask them not to do it again. Setting firm professional boundaries is the correct way to handle the situation. Question 55. An Alzheimer's resident moves belongings of other clients. What should you do? Option A. Return them to their room and lock the door. Option B. Find the missing articles and return them. Option C. Walk with them to keep them from wandering. Option D. Tell other clients they are harmless. The correct answer is option B. Find the missing articles and return them. Correcting the results of the behavior with patience is the best response. Question 56. Which of the following is considered a restraint alternative? Option A. A lap buddy or tray. Option B. A sedative. Option C. Effective pain management. Option D. A hand mitt. The correct answer is option C. Effective pain management. Treating the underlying cause of agitation can remove the need for physical restraints. Question 57. How can nursing assistants best provide a client with a sense of security? Option A. By rushing through care. Option B. By leaving the room without speaking. Option C. By explaining all routines and procedures. Option D. By talking to other staff while providing care. The correct answer is option C. By explaining all routines and procedures. Clear communication and predictability help residents feel safe. Question 58. When caring for a client using a restraint, what should the assistant do? Option A. Assess the client once every hour. Option B. Ensure the device is very tight. Option C. Check the client's body alignment. Option D. Release the device once a shift. The correct answer is option C. Check the client's body alignment. Monitoring alignment and comfort is critical for residents in restraints. Question 59. What should you do first when changing an ostomy bag? Option A. Put on gloves. Option B. Wash your hands. Option C. Explain the procedure to the client. Option D. Wash the area around the stoma. The correct answer is option C. Explain the procedure to the client. Communication should always happen before starting any physical procedure. Question 60. When giving a back rub, the nursing assistant should do what? Option A. Use circular motions over bony areas. Option B. Position the client in a supine position. Option C. Use short, light strokes. Option D. Warm the lotion in the microwave. The correct answer is option A. Use circular motions over bony areas. Circular motions over bony prominences help stimulate circulation. Question 61. What is the first thing to do when finding an unresponsive client? Option A. Start compressions. Option B. Call for help. Option C. Close the door. Option D. Call the family. The correct answer is option B. Call for help. Getting emergency help is the priority when a resident is unresponsive. Question 62. When operating a manual bed, the nursing assistant should remember to do what? Option A. Elevate the head at all times. Option B. Lock the wheels when cranks are folded. Option C. Fold the cranks under the bed. Option D. Keep the bed in the neutral position. The correct answer is option C. Fold the cranks under the bed. Folding cranks prevents them from being a tripping hazard in the room. Question 63. In what position should you place an unconscious person for oral care? Option A. Supine. Option B. Lateral. Option C. Prone. Option D. Sims position. The correct answer is option B. Lateral. A side-lying position prevents the resident from choking on fluids during care. Question 64. Where should the nursing assistant place soiled linen? Option A. On the floor. Option B. On the chair. Option C. In the dirty linen container. Option D. On the overbed table. The correct answer is option C. In the dirty linen container. Placing linen in the correct container prevents the spread of infection. Question 65. What is the best razor to use when shaving a diabetic client? Option A. A safety razor. Option B. An electric razor. Option C. A disposable razor. Option D. A straight edge razor. The correct answer is option B. An electric razor. Electric razors reduce the risk of nicks and cuts which are dangerous for diabetics. Question 66. How can you communicate with a client who only speaks a foreign language? Option A. Use gestures. Option B. Speak slower and louder. Option C. Listen and say nothing. Option D. Use an interpretation guide. The correct answer is option D. Use an interpretation guide. Interpretation tools or services are necessary for accurate communication. Question 67. When transferring a client to a different unit, what is the most important information to get? Option A. The phone number to their room. Option B. The medical diagnosis. Option C. The name of the spouse. Option D. The client's name and new room number. The correct answer is option D. The client's name and new room number. Correct identification and location are essential for a safe transfer. Question 68. What is the main purpose of continuing education for a nursing assistant? Option A. Client safety. Option B. Review of skills. Option C. A facility compliance. Option D. Promoting teamwork. The correct answer is option A. Client safety. Ongoing education keeps staff current on safety protocols and care standards. Question 69. Why are incident reports written? Option A. To inform the physician. Option B. To notify family members. Option C. To identify who is at fault. Option D. To determine patterns and trends. The correct answer is option D. To determine patterns and trends. Analyzing incidents helps the facility improve safety and prevent future errors. Question 70. A button hook and a sock assist are part of what kind of care? Option A. Restorative and rehabilitation. Option B. Activities of daily living only. Option C. Disability and reactivity. Option D. Prosthetic mobility. The correct answer is option A. Restorative and rehabilitation. Adaptive devices are used in restorative programs to help residents be independent. Question 71. When ambulating an unsteady client, what is best to use? Option A, a walker. Option B, a gait belt. Option C, a quad cane. Option D, a wheelchair. The correct answer is option B, a gait belt. A gait belt provides a secure place for the assistant to support the resident's balance. Question 72. The client's Bill of Rights includes which of the following? Option A, free medical care. Option B, a freedom of choice. Option C, access to the medicine cart. Option D, access to the laundry room. The correct answer is option B, freedom of choice. Autonomy and choice are protected rights for all residents. Question 73. Which statement might strongly support that a client is considering suicide? Option A, I think I need to see a psychiatrist. Option B, I might as well be dead. Option C, I do not really care. Option D, we all have to go sometime. The correct answer is option B, I might as well be dead. Direct comments about death or suicide must be taken seriously and reported. Question 74. A client answers every question by nodding and saying yes. How should you respond? Option A, inform the nurse of the behavior. Option B, ask a family member to translate. Option C, speak to the client with medical terms. Option D, shout at the client. The correct answer is option A, inform the nurse of the behavior. Abnormal communication patterns should be reported as they may signal a mental change. Question 75. You gave a client the wrong diet. What should you do after realizing the error? Option A, report the error immediately to the nurse. Option B, ignore it and move to the next task. Option C, remove the evidence of the error. Option D, blame another nursing assistant. The correct answer is option A, report the error immediately to the nurse. Honest reporting is necessary to monitor the resident for potential harm. Question 76. What should be done with hearing aids that are not in use? Option A, placed in the client's pocket. Option B, left turned on. Option C, have the battery removed. Option D, left on the bedside table. The correct answer is option C, have the battery removed. Removing the battery prevents it from draining and prevents the device from whistling. Question 77. A family member asks what medication a client is receiving. What should you do? Option A, allow them to read the chart. Option B, tell them what is given. Option C, refer the family member to the nurse. Option D, give them the chart. The correct answer is option C, refer the family member to the nurse. Nursing assistants are not authorized to discuss medications with families. Question 78. A client's religious beliefs do not allow them to eat certain foods. To whom do you report? Option A, the dietitian. Option B, other nursing assistants. Option C, the charge nurse. Option D, the client's family. The correct answer is option C, the charge nurse. Reporting to the nurse ensures the care plan and dietary orders are updated. Question 79. An independent resident now asks for help walking to the bathroom. What do you do? Option A, assist the resident and report the change to the nurse. Option B, understand that this is a normal part of aging. Option C, update the care plan yourself. Option D, encourage them to do it alone. The correct answer is option A, assist the resident and report the change to the nurse. Any sudden decline in function must be assessed by a nurse for a medical cause. Question 80. What should you do with a used disposable razor? Option A, throw it in the trash can. Option B, place it in a sharps container immediately. Option C, clean and dry it for reuse. Option D, wrap it in a paper towel. The correct answer is option B, place it in a sharps container immediately. Used razors are hazardous sharps and must be disposed of in puncture-proof containers. Question 81. The Health Insurance Portability and Accountability Act is important because it does what? Option A, allows residents to carry insurance between facilities. Option B provides insurance coverage for workers. Option C identifies protected health information that must remain confidential. Option D provides accountability for care. The correct answer is option C. Identifies protected health information that must remain confidential. Privacy of health information is a federal legal requirement. Question 82. Before leaving a resident who needs help to walk in their room, what must you do? Option A. Turn on the television. Option B. Make sure the bedpan is within reach. Option C. Place the call light within reach. Option D. Remind them not to walk alone. The correct answer is option C. Place the call light within reach. Ensuring the resident can call for help is the most critical safety step. Question 83. You notice new swelling in a resident's ankles while bathing. What is the best response? Option A. Ask if they have been eating salty foods. Option B. Elevate the legs and check again later. Option C. Report the swelling to the charge nurse. Option D. Avoid bathing the lower legs. The correct answer is option C. Report the swelling to the charge nurse. New edema can indicate heart or kidney issues and requires a professional assessment. Question 84. A resident has a contracture of the right arm. How do you put on a button front shirt? Option A. Put the left sleeve on first. Option B. Ask which arm they prefer. Option C. Put the right sleeve on first. Option D. Put both on at the same time. The correct answer is option C. Put the right sleeve on first. When dressing a resident with a limitation, always dress the affected side first. Question 85. When weighing a resident, it is important to make sure of which of the following? Option A. The last weight is available. Option B. The scale measures kilograms. Option C. The resident is in pajamas. Option D. The scale is balanced or calibrated first. The correct answer is option D. The scale is balanced or calibrated first. Starting with a zeroed scale is necessary for an accurate measurement. Question 86. A resident reports his watch is missing. What should the nursing assistant do? Option A. Ask if he thinks someone took it. Option B. Check the lost and found. Option C. Ask who worked the previous shift. Option D. Ask for permission to help look around the room. The correct answer is option D. Ask for permission to help look around the room. Assisting the resident while respecting their privacy is the first step in finding lost items. Question 87. What is an acute illness? Option A. A sudden illness from which the person is expected to recover. Option B. An ongoing illness with no known cure. Option C. An illness that will result in death. Option D. A slow and gradual loss of function. The correct answer is option A. A sudden illness from which the person is expected to recover. Acute illnesses have a rapid onset and are generally short-lived. Question 88. What is a chronic illness? Option A. A sudden illness that is cured quickly. Option B. An ongoing illness with no known cure. Option C. An illness that only affects children. Option D. A temporary loss of memory. The correct answer is option B. An ongoing illness with no known cure. Chronic illnesses like heart disease require long-term management. Question 89. What is a terminal illness? Option A. An illness from which the person will recover. Option B. An illness that will not result in recovery and will lead to death. Option C. A type of skin infection. Option D. A broken bone that will not heal. The correct answer is option B. An illness that will not result in recovery and will lead to death. Terminal illness care focuses on comfort and dignity during the dying process. Question 90. What does ALR stand for? Option A. Advanced Life Resuscitation. Option B. Assisted Living Residence. Option C. Ambulatory leg rotation. Option D. Acute liver recovery. The correct answer is option B. Assisted living residence. An assisted living residence provides housing and support for daily activities. Question 91. What is the role of the Director of Nursing? Option A. To cook the facility meals. Option B. To manage the facility's finances. Option C. The registered nurse responsible for the entire nursing staff. Option D. To drive the resident transport bus. The correct answer is option C. The registered nurse responsible for the entire nursing staff. The Director of Nursing is the highest clinical authority in the facility. Question 92. What is a skilled nursing facility? Option A. A facility for independent seniors. Option B. A place that provides 24-hour care and rehabilitation. Option C. A hospital unit for emergency surgery. Option D. A group home for teenagers. The correct answer is option B. A place that provides 24-hour care and rehabilitation. These facilities provide high-level nursing and therapy for residents. Question 93. What does it mean if a resident is alert and oriented times 4? Option A. They know their name only. Option B. They know where they are. Option C. They are aware of self, place, date, time, and events. Option D. They are confused about the date. The correct answer is option C. They are aware of self, place, date, time, and events. This level of orientation shows the resident is fully aware of their surroundings. Question 94. What is the purpose of respite care? Option A. To provide permanent housing. Option B. To provide short-term care to give a home caregiver a break. Option C. To provide emergency trauma care. Option D. To perform major surgery. The correct answer is option B. To provide short-term care to give a home caregiver a break. Respite care supports family members who are caring for loved ones at home. Question 95. Who helps a resident restore physical function such as walking? Option A. Occupational therapist. Option B. Physical therapist. Option C. Social worker. Option D. A dietitian. The correct answer is option B. Physical therapist. Physical therapists focus on mobility, strength, and balance. Question 96. Who helps a resident return to their activities of daily living? Option A. A physical therapist. Option B. Social worker. Option C. Occupational therapist. Option D. Pharmacist. The correct answer is option C. Occupational therapist. Occupational therapists focus on adapting environments and tasks for daily use. Question 97. What is Medicare? Option A. Federal health insurance for people over 65. Option B. Health insurance for children only. Option C. A program for low-income families. Option D. Private insurance for employees. The correct answer is option A. Federal health insurance for people over 65. Medicare is the primary insurance provider for the elderly in America. Question 98. What is Medicaid? Option A. Insurance for people over 65. Option B. A program sponsored by the government for low-income individuals. Option C. Insurance that only covers surgery. Option D. Insurance provided by a local church. The correct answer is option B. A program sponsored by the government for low-income individuals. Medicaid provides healthcare coverage based on financial need. Question 99. What is the primary role of an ombudsman? Option A. To manage the nursing schedule. Option B. To help residents voice grievances and protect their rights. Option C. To perform surgeries. Option D. To clean the facility. The correct answer is option B. To help residents voice grievances and protect their rights. An ombudsman is an independent advocate for residents in long-term care. Question 100. What are ethics? Option A. The rules of a card game. Option B. Knowledge of right and wrong. Option C. The laws of the state. Option D. The medical history of a resident. The correct answer is option B. Knowledge of right and wrong. Ethics guide the professional behavior of healthcare workers. Question 101. What is the medical term for high blood pressure? Option A, diabetes. Option B, hypertension. Option C, hypotension. Option D, a stroke. The correct answer is option B, hypertension. Hypertension is a chronic condition that must be managed to prevent complications. Question 102. What is the term for low blood pressure? Option A, hypertension. Option B, hypotension. Option C, hypoxia. Option D, hyperthermia. The correct answer is option B, hypotension. Hypotension can cause dizziness and increased fall risk. Question 103. What is the standard unit of measurement for fluids in healthcare? Option A, ounces. Option B, milliliters. Option C, pounds. Option D, meters. The correct answer is option B, milliliters. Milliliters or cubic centimeters are used to track precise fluid intake and output. Question 104. How many milliliters are in 1 ounce? Option A, 10. Option B, 30. Option C, 60. Option D, 100. The correct answer is option B, 30. 30 milliliters is the standard conversion used for fluid calculations. Question 105. What is the medical term for breathing in? Option A, exhalation. Option B, inhalation. Option C, apnea. Option D, dyspnea. The correct answer is option B, inhalation. Inhalation is the act of bringing air into the lungs. Question 106. What is the medical term for breathing out? Option A, inhalation. Option B, exhalation. Option C, tachypnea. Option D, bradypnea. The correct answer is option B, exhalation. Exhalation is the process of removing carbon dioxide from the body. Question 107. What is the medical term for slow breathing? Option A, tachypnea. Option B, bradypnea. Option C, apnea. Option D, eupnea. The correct answer is option B, bradypnea. Bradypnea involves a respiration rate lower than 12 breaths per minute. Question 108. What is the medical term for rapid breathing? Option A, bradypnea. Option B, tachypnea. Option C, apnea. Option D, dyspnea. The correct answer is option B, tachypnea. Tachypnea involves a respiration rate higher than 20 breaths per minute. Question 109. What is the medical term for a stroke? Option A, myocardial infarction. Option B, cerebrovascular accident. Option C, hypertension. Option D, angina. The correct answer is option B, cerebrovascular accident. A stroke occurs when blood flow to the brain is interrupted. Question 110. What does DNR stand for? Option A, do not remove. Option B, do not resuscitate. Option C, daily nursing report. Option D, a decision not recorded. The correct answer is option B, do not resuscitate. This legal order specifies that CPR should not be performed. Question 111. What is the medical term for blood in the urine? Option A, dysuria. Option B, hematuria. Option C, nocturia. Option D, polyuria. The correct answer is option B, hematuria. Hematuria can indicate an infection or injury in the urinary tract. Question 112. What is the medical term for difficult or painful urination? Option A, hematuria. Option B, dysuria. Option C, nocturia. Option D, oliguria. The correct answer is option B, dysuria. Dysuria is a common symptom of a urinary tract infection. Question 113. What is the medical term for urinating frequently at night? Option A, dysuria. Option B, nocturia. Option C, polyuria. Option D, hematuria. The correct answer is option B, nocturia. Nocturia often affects the sleep patterns of the elderly. Question 114. What is the medical term for scant or small amounts of urine? Option A, polyuria. Option B, oliguria. Option C, dysuria. Option D, hematuria. The correct answer is option B, oliguria. Oliguria can be a sign of dehydration or kidney problems. Question 115. What is the medical term for large amounts of urine? Option A, oliguria. Option B, polyuria. Option C, dysuria. Option D, nocturia. The correct answer is option B, polyuria. Polyuria can be a symptom of diabetes or high fluid intake. Question 116. What is the medical term for difficulty swallowing? Option A, dysphagia. Option B, dysphagia. Option C, dyspnea. Option D, dysuria. The correct answer is option B, dysphagia. Dysphagia requires careful monitoring during meals to prevent choking. Question 117. What is the medical term for a heart attack? Option A, myocardial infarction. Option B, cerebrovascular accident. Option C, hypertension. Option D, cardiac arrest. The correct answer is option A, myocardial infarction. A heart attack occurs when blood flow to the heart muscle is blocked. Question 118. What is the term for a resident who leaves without notifying the facility? Option A, evacuation. Option B, elopement. Option C, escape. Option D, exit. The correct answer is option B, elopement. Elopement is a major safety concern in long-term care facilities. Question 119. What is the medical term for vomit? Option A, flatulence. Option B, emesis. Option C, flatus. Option D, sputum. The correct answer is option B, emesis. Emesis must be documented including color, amount, and consistency. Question 120. What is the medical term for gas passed through the rectum? Option A, emesis. Option B, flatus. Option C, sputum. Option D, feces. The correct answer is option B, flatus. Flatus is a normal part of the digestive process. Question 121. What is the term for cells not having enough oxygen? Option A, hyperoxia. Option B, hypoxia. Option C, cyanosis. Option D, anemia. The correct answer is option B, hypoxia. Hypoxia is a serious condition that can lead to tissue damage. Question 122. What is the term for a blue color to the skin? Option A, jaundice. Option B, cyanosis. Option C, pallor. Option D, erythema. The correct answer is option B, cyanosis. Cyanosis indicates a lack of oxygen in the bloodstream. Question 123. What is the medical term for the wasting away of a muscle? Option A, hypertrophy. Option B, atrophy. Option C, dystrophy. Option D, anatomy. The correct answer is option B, atrophy. Atrophy is common in residents with limited mobility. Question 124. What is the medical term for sweating? Option A, dehydration. Option B, diaphoresis. Option C, cyanosis. Option D, jaundice. The correct answer is option B, diaphoresis. Heavy sweating can be a sign of pain, fever, or a heart attack. Question 125. What is the medical term for the skin turning yellow? Option A, cyanosis. Option B, jaundice. Option C, pallor. Option D, bruising. The correct answer is option B, jaundice. Jaundice is often associated with liver or gallbladder issues. Question 126. What is the medical term for difficulty breathing? Option A, apnea. Option B, dyspnea. Option C, tachypnea. Option D, bradypnea. The correct answer is option B, dyspnea. Dyspnea should be reported to the nurse immediately. Question 127. What is the clinical definition of aiding and abetting? Option A, committing a crime alone. Option B, having knowledge of a crime without being present during the act. Option C, reporting a crime after it happens. Option D, preventing a crime from occurring. The correct answer is option B, having knowledge of a crime without being present during the act. Aiding and abetting refers to the legal concept of having knowledge of a crime or assisting in some way without being the primary perpetrator. Question 128. Which term refers to making false statements about a person in writing? Option A is slander. Option B, libel. Option C, assault. Option D, battery. The correct answer is option B, libel. Libel is the act of damaging a person's reputation through written words or images. Question 129. What is the definition of negligence? Option A, an intentional act of harm. Option B, a professional mistake by a doctor. Option C, an unintentional wrong where a person did not act in a reasonable manner. Option D, a physical threat without contact. The correct answer is option C, an unintentional wrong where a person did not act in a reasonable manner. Negligence occurs when a caregiver fails to provide the standard of care that a reasonable person would provide. Question 130. Making a false statement about someone orally is known as which of the following? Option A, libel. Option B, neglect. Option C, slander. Option D, battery. The correct answer is option C, slander. Slander is the verbal form of defamation of character. Question 131. What is the definition of false imprisonment? Option A, threatening to harm a resident. Option B, touching someone without their consent. Option C, unlawful restraint or restriction of a person's freedom of movement. Option D, failing to provide necessary fluids. The correct answer is option C, unlawful restraint or restriction of a person's freedom of movement. Restricting a resident's movement without a medical order or legal justification is false imprisonment. Question 132. Saying or doing something to deceive another person is the definition of which term? Option A, assault. Option B, battery. Option C, fraud. Option D, neglect. The correct answer is option C, fraud. Fraud involves intentional deception to secure unfair or unlawful gain. Question 133. Which term refers to threatening to harm someone without their consent? Option A, assault. Option B, battery. Option C, libel. Option D, slander. The correct answer is option A, assault. Assault is the act of creating an apprehension of harmful or offensive contact. Question 134. Touching a person's body without his or her consent is defined as which of the following? Option A, assault. Option B, battery. Option C, negligence. Option D, malpractice. The correct answer is option B, battery. Battery is the actual physical contact or harm done to another person without permission. Question 135. Which type of tissue connects and supports other tissues in the body? Option A, epithelial tissue. Option B, nerve tissue. Option C, connective tissue. Option D, muscle tissue. The correct answer is option C, connective tissue. Connective tissue includes structures like bones and cartilage that hold the body together. Question 136. Which type of tissue stretches and contracts to allow the body to move? Option A, epithelial tissue. Option B, muscle tissue. Option C, nerve tissue. Option D, connective tissue. The correct answer is option B, muscle tissue. Muscle tissue is specialized for contraction and generating physical force. Question 137. Which type of tissue receives and carries impulses to the brain and back to body parts? Option A, connective tissue. Option B, epithelial tissue. Option C, muscle tissue. Option D, nerve tissue. The correct answer is option D, nerve tissue. Nerve tissue is responsible for communication and coordination throughout the body. Question 138. Groups of different tissues that work together to perform the same function are called what? Option A, systems. Option B, organs. Option C, cells. Option D, membranes. The correct answer is option B, organs. Organs like the heart or lungs are composed of multiple tissue types working in unison. Question 139. Which of the following is considered the largest organ of the human body? Option A, the heart. Option B, the lungs. Option C, the skin. Option D, the liver. The correct answer is option C, the skin. The skin covers the entire external surface of the body and serves several vital functions. Question 140. What is the name of the outer layer of the skin? Option A, dermis. Option B, epidermis. Option C, subcutaneous tissue. Option D, epithelial tissue. The correct answer is option B, epidermis. The epidermis is the thin outer layer that provides a waterproof barrier. Question 141. What is the name of the inner layer of the skin? Option A, dermis. Option B, epidermis. Option C, periosteum. Option D, endosteum. The correct answer is option A, dermis. The dermis contains blood vessels and nerves and sits beneath the epidermis. Question 142. Besides regulating temperature, what is a primary function of sweat glands? Option A, producing oil for the hair. Option B, eliminating solid waste. Option C, helping the body cool down through evaporation. Option D, producing red blood cells. The correct answer is option C, helping the body cool down through evaporation. Sweating is a critical mechanism for maintaining homeostasis in body temperature. Question 143. How many total bones are typically found in the adult human body? Option A, 150. Option B, 206. Option C, 300. Option D, 412. The correct answer is option B, 206. The human skeleton is made of 206 bones that provide structure and protect organs. Question 144. The femur is an example of which type of bone? Option A, flat bone. Option B, short bone. Option C, long bone. Option D, the irregular bone. The correct answer is option C, long bone. Long bones are characterized by being longer than they are wide and having a shaft. Question 145. Which minerals are most needed for healthy bone formation and growth? Option A, sodium and potassium. Option B, iron and zinc. Option C, calcium and phosphorus. Option D, magnesium and vitamin C. The correct answer is option C, calcium and phosphorus. Calcium and phosphorus provide the structural strength for bone tissue. Question 146. What is the name of the membrane that covers the surface of bones? Option A, a synovial membrane. Option B, periosteum. Option C, dermis. Option D, epidermis. The correct answer is option B, periosteum. The periosteum is a dense layer of vascular connective tissue enveloping the bones. Question 147. Where are red blood cells formed within the body? Option A, the heart. Option B, the liver. Option C, the bone marrow. Option D, the spleen. The correct answer is option C, the bone marrow. The soft tissue inside the center of large bones produces new red blood cells. Question 148. Which type of connective tissue is found at the ends of long bones to prevent friction? Option A, ligament. Option B, tendon. Option C, cartilage. Option D, a nerve. The correct answer is option C, cartilage. Cartilage acts as a cushion between bones at the joints. Question 149. Which type of joint allows for the widest range of movement, such as in the hip or shoulder? Option A, hinge joint. Option B, pivot joint. Option C, ball and socket joint. Option D, fixed joint. The correct answer is option C, ball and socket joint. Ball and socket joints allow for rotation and movement in multiple planes. Question 150. The elbow is an example of which type of joint? Option A, ball and socket joint. Option B, hinge joint. Option C, pivot joint. Option D, fixed joint. The correct answer is option B, hinge joint. Hinge joints allow for movement primarily in one direction like a door. Question 151. What happens to blood vessels when the body needs to maintain heat? Option A, they dilate. Option B, they constrict. Option C, they expand. Option D, they stop moving blood. The correct answer is option B, they constrict. Vasoconstriction reduces blood flow to the skin surface to keep core organs warm. Question 152. What happens to blood vessels when the body is too warm? Option A, they constrict. Option B, they dilate. Option C, they shorten. Option D, they disappear. The correct answer is option B, they dilate. Vasodilation increases blood flow to the skin to release heat. Question 153. What is the medical term for red blood cells? Option A, leukocytes. Option B, platelets. Option C, erythrocytes. Option D, plasma. The correct answer is option C, erythrocytes. Erythrocytes are responsible for transporting oxygen throughout the body. Question 154. What is the medical term for white blood cells? Option A, erythrocytes. Option B, leukocytes. Option C, platelets. Option D, erythrina. The correct answer is option B, leukocytes. Leukocytes are the cells of the immune system that protect the body against infection. Question 155. Which component of the blood is responsible for blood clotting? Option A, erythrocytes. Option B, leukocytes. Option C, platelets. Option D, plasma. The correct answer is option C, platelets. Platelets are cell fragments that clump together to stop bleeding. Question 156. How many chambers are in the human heart? Option A, 2. Option B, 3. Option C, 4. Option D, 6. The correct answer is option C, 4. The heart is divided into 2 atria and 2 ventricles. Question 157. Where does the right atrium of the heart receive blood from? Option A, the lungs. Option B, the body tissues. Option C, the brain only. Option D, the left ventricle. The correct answer is option B, the body tissues. The right atrium collects deoxygenated blood returning from the body. Question 158. Which chamber of the heart pumps blood specifically to the lungs? Option A, left atrium. Option B, right ventricle. Option C, left ventricle. Option D, right atrium. The correct answer is option B, right ventricle. The right ventricle sends blood to the lungs to pick up oxygen. Question 159. Which chamber of the heart pumps oxygenated blood to all parts of the body? Option A, right ventricle. Option B, left ventricle. Option C, right atrium. Option D, left atrium. The correct answer is option B, left ventricle. The left ventricle is the most muscular chamber as it must pump blood through the entire body. Question 160. Which blood vessels carry blood away from the heart? Option A, veins. Option B, arteries. Option C, capillaries. Option D, venules. The correct answer is option B, arteries. Arteries carry oxygen-rich blood to the body under high pressure. Question 161. Which blood vessels carry blood back to the heart? Option A, arteries. Option B, veins. Option C, arterioles. Option D, capillaries. The correct answer is option B, veins. Veins transport deoxygenated blood from the tissues back to the heart. Question 162. How many muscles are typically in the human body? Option A, 200. Option B, 500. Option C, 750. Option D, 1000. The correct answer is option B, 500. The body has over 500 muscles that allow for both voluntary and involuntary movement. Question 163. Which structure connects muscles to bones? Option A, ligaments. Option B, tendons. Option C, cartilage. Option D, fascia. The correct answer is option B, tendons. Tendons are fibrous cords that transmit the force of a muscle to a bone. Question 164. Which structure connects bones to other bones at a joint? Option A, tendons. Option B, ligaments. Option C, cartilage. Option D, skin. The correct answer is option B, ligaments. Ligaments provide stability to joints by holding bones together. Question 165. What is a primary way the body produces heat when it is cold? Option A, sweating. Option B, shivering. Option C, sleeping. Option D, deep breathing. The correct answer is option B, shivering. Shivering is a rapid muscle contraction that generates thermal energy. Question 166. Which part of the brain manages the highest functions like reasoning, memory, and speech? Option A, cerebellum. Option B, brainstem. Option C, cerebrum. Option D, medulla. The correct answer is option C, cerebrum. The cerebrum is the largest part of the brain and controls voluntary activities. Question 167. Which part of the brain regulates and coordinates body movements for balance? Option A, cerebrum. Option B, brainstem. Option C, cerebellum. Option D, thalamus. The correct answer is option C, cerebellum. The cerebellum is located at the back of the brain and handles motor coordination. Question 168. Which vital functions does the medulla control? Option A, reasoning and memory. Option B, sight and hearing. Option C, heart rate and breathing. Option D, digestion and sleep. The correct answer is option C, heart rate and breathing. The medulla is part of the brainstem and manages basic life-sustaining functions. Question 169. How many pairs of cranial nerves are in the peripheral nervous system? Option A, 12. Option B, 31. Option C, 10. Option D, 24. The correct answer is option A, 12. There are 12 pairs of cranial nerves that connect the brain to parts of the head and neck. Question 170. How many pairs of spinal nerves are in the peripheral nervous system? Option A, 12. Option B, 31. Option C, 50. Option D, 15. The correct answer is option B, 31. There are 31 pairs of spinal nerves that emerge from the spinal cord. Question 171. Which system is responsible for speeding up body functions during stress? Option A, parasympathetic nervous system. Option B, sympathetic nervous system. Option C, digestive system. Option D, endocrine system. The correct answer is option B, sympathetic nervous system. The sympathetic nervous system triggers the fight or flight response. Question 172. Which system is responsible for slowing down body functions to conserve energy? Option A, sympathetic nervous system. Option B, parasympathetic nervous system. Option C, respiratory system. Option D, a circulatory system. The correct answer is option B, parasympathetic nervous system. The parasympathetic nervous system helps the body rest and digest. Question 173. What information is typically found on a resident's identification bracelet? Option A, name and room number. Option B, birth date and age. Option C, name of their doctor. Option D. All of these are correct. The correct answer is option D. All of these are correct. Identification bands provide multiple pieces of data to ensure the correct resident is receiving care. Question 174. How many identifiers must you check before performing care on a resident? Option A, 1. Option B, 2. Option C, 3. Option D, 4. The correct answer is option B, 2. Standard safety practice requires checking at least 2 identifiers like name and birth date. Question 175. What does the abbreviation FBAO stand for? Option A, a frequent body action observation. Option B, foreign body airway obstruction. Option C, full body assessment order. Option D, fixed bone alignment option. The correct answer is option B, foreign body airway obstruction. FBAO is the medical term for choking on an object. Question 176. In the fire safety acronym RACE, what does the letter A stand for? Option A, activate the alarm. Option B, aim the extinguisher. Option C, apply water. Option D, assist the residents. The correct answer is option A, activate the alarm. The second step in a fire emergency is to alert the facility and call for help. Question 177. In the fire safety acronym RACE, what does the letter C stand for? Option A, call the family. Option B, confine the fire by closing doors. Option C, carry the residents out. Option D, check for smoke. The correct answer is option B, confine the fire by closing doors. Closing doors and windows help slow the spread of fire and smoke. Question 178. In the fire safety acronym RACE, what does the letter E stand for? Option A, evacuate the building. Option B, examine the area. Option C, extinguish the fire if safe. Option D, empty the room. The correct answer is option C, extinguish the fire if safe. Extinguishing is the final step and should only be attempted if the fire is small and you are safe. Question 179. In the fire extinguisher acronym PASS, what does the letter S stand for? Option A, start the spray. Option B, sweep the nozzle back and forth. Option C, stop the fire. Option D, step back. The correct answer is option B, sweep the nozzle back and forth. Sweeping the nozzle at the base of the fire ensures the extinguishing agent covers the fuel. Question 180. What is the definition of elopement in a healthcare facility? Option A, when 2 residents get married. Option B, when a resident leaves the facility without notifying staff. Option C, when a resident moves to a different room. Option D, when a resident refuses a meal. The correct answer is option B, when a resident leaves the facility without notifying staff. Elopement is a serious safety risk where a resident wanders out of the building. Question 181. How often should you check on a resident who is in physical restraints? Option A, every hour. Option B, every 2 hours. Option C, every 15 minutes. Option D, once per shift. The correct answer is option C, every 15 minutes. Frequent monitoring is required to ensure the resident's safety and well-being. Question 182. What does the abbreviation HAI stand for in infection control? Option A, highly active infection. Option B, a healthcare-associated infection. Option C, hospital-acquired injury. Option D, human antibody interaction. The correct answer is option B, healthcare-associated infection. HAI refers to infections that patients acquire while receiving treatment in a medical facility. Question 183. Which type of precautions are used for every resident regardless of their diagnosis? Option A, contact precautions. Option B, standard precautions. Option C, droplet precautions. Option D, airborne precautions. The correct answer is option B, standard precautions. Standard precautions prevent the spread of pathogens through blood and body fluids. Question 184. What equipment is required for contact precautions? Option A, mask and goggles. Option B, gown and gloves. Option C, respirator mask only. Option D, no equipment needed. The correct answer is option B, gown and gloves. Contact precautions are used for infection spread by direct or indirect contact. Question 185. What equipment is required for airborne precautions? Option A, surgical mask and gloves. Option B, gown and gloves and an N95 respirator mask. Option C, goggles and gown only. Option D, a face shield only. The correct answer is option B, gown and gloves and an N95 respirator mask. Airborne pathogens are very small and require specialized respirator masks for protection. Question 186. In which direction should you rinse your hands during the hand washing process? Option A, fingertips pointing up. Option B, fingertips pointing down. Option C, hands held flat. Option D, it does not matter. The correct answer is option B, fingertips pointing down. Rinsing with fingertips down allows pathogens to flow off the hands and into the sink. Question 187. What is the medical term for the loss or leakage of urine? Option A, voiding. Option B, urinary incontinence. Option C, hematuria. Option D, dysuria. The correct answer is option B, urinary incontinence. Incontinence can range from occasional leaking to total loss of bladder control. Question 188. What is the medical term for emptying urine from the bladder? Option A, defecation. Option B, voiding. Option C, emesis. Option D, exhalation. The correct answer is option B, voiding. Voiding and urinating are the terms used for bladder elimination. Question 189. What is a catheter? Option A, a tube used to feed a resident. Option B, a tube used to drain fluid through a body opening. Option C, a device used to measure blood pressure. Option D, a tool for checking vision. The correct answer is option B, a tube used to drain fluid through a body opening. Urinary catheters are commonly used to drain urine from the bladder into a bag. Question 190. What is the medical term for blood in the urine? Option A, dysuria. Option B, hematuria. Option C, nocturia. Option D, polyuria. The correct answer is option B, hematuria. Hematuria is an objective sign that must be reported to the nurse immediately. Question 191. What is the term for urinating at night? Option A, nocturia. Option B, dysuria. Option C, hematuria. Option D, oliguria. The correct answer is option B, dysuria. Frequent nighttime urination can increase the risk of falls for elderly residents.